Hello, my name is Andrea Stallings. I'm a BSN student at Liberty University doing my head-to-toe assessment for Nursing 210. This is my patient, Roxandra. So I'm going to start my assessment by washing my hands. And Roxandra, you consent to this assessment?
Yes.
Okay. Okay, so the things that I have here for my assessment are the Rosenbaum chart, the Snellen test. I have my otoscope, my ophthalmoscope. I have a tuning fork, a reflex hammer, tongue depressor, and measurement. I have some coins and I have some cotton and some Q-tips. Okay, so now I'm ready to get started. So first I'm going to be inspecting and palpating the upper and lower extremities. So what I'm going to do is I'm going to look at her upper extremities here. They look normal for race. The color is normal for race. The temperature is warm to touch, not hot, not cold, just warm to touch. I don't see any masses, bumps, bruises. When I don't feel any masses. So her lower extremities. First I'm gonna test her turgor, which is her hydration. So I'm gonna pinch up a little bit of skin and test her turgor. That's good. You're hydrated. I don't see any lesions. Her lower extremities, warm to the touch. Hair distribution is minimal but even. I don't see any bruises. I don't feel any masses. The temperature is warm. No edema. No varicosities. So then I'm going to move over to the nails. I'm going to look at her nail beds. They're translucent. No clubbing. Her cuticles are even and attached to her skin. Her capillary refill is less than 3 seconds. Do the other hand. Capillary refill, less than 3 seconds. Nails are translucent. Same thing with the lower extremities. Capillary refill, less than 3 seconds. No edema. No cyanosis. And her nails adhere to the nail beds. So then I'm going to move on to the head, face, and scalp. I'm going to inspect her head, her scalp, and her face. Her color is good, normal, warm. Her scalp is pink. There's no lesions. It's not too greasy, it's not too dry. Hair is distributed evenly. When I palpate, there's no masses, bumps. The quality and the texture of her hair is good, not too dry. So I'm going to palpate her paranasal sinuses, and I want you to tell me if you feel any pain. I'm going to palpate her frontal sinuses. I want you to tell me. And percuss, I want you to tell me if you feel any pain. I'm going to palpate your temporomandibular joint. Feeling for crepitus, movement, clicks. I'm going to test your cranial nerve 5, your trigeminal. I want you to clench your jaw. Do you feel any pain when you do that?
No.
Okay, good. I'm going to check your cranial nerve 7, which is your facial nerve. I want you to smile, frown. Okay, raise your eyebrows. Okay, good, good. I want you to open and show me your teeth. Puff out your cheeks. Good, good. Okay, and purse your lips. Okay. Oh, I wanted to show you too that I have my rubric with me. We are allowed to use the rubric during this examination. I have no notes, but I am referring to my rubric at times, and I would like you to scan the room with the camera to show that there are no notes anywhere. That's part of the exam she had this morning to study that. Okay, now I'm going to ask you to, I'm going to do a Snellen test. This is going to test your far vision, your visual acuity. So I'll have you stand up, come to the end of the bed. Okay, I want you to cover one eye and tell me which line can you see, and can you read the letters?
I'm reading the red line.
Okay.
D, E, F, T, E, C.
Okay. Okay. Good. Other eye?
Red line.
Okay.
D, E, F, D, T, E, C.
Okay, good. So on the red line, if you go by the lines, her vision is 20/20. The bottom number is, the lower the number, the better the vision. Okay. Have a seat. And the Rosenbaum test is for your near vision. So I'm going to have you hold this, and I would like you to cover one eye. And which line can you read? Which line?
The bottom line.
Okay. And that's testing her near vision.
Bottom line.
Okay. That's the Rosenbaum test, near vision. Okay. So now what I'm going to do is test your peripheral visual fields and confrontation. So I'm going to close one eye, cover one eye, and I want you to tell me when this is her peripheral vision, when you can see my finger.
No.
Okay.
No.
Okay, good. Other side. Good.
No. No.
Okay, good. Thank you. So I'm going to test your cranial nerve 3 oculomotor, cranial nerve 4 trochlear, and cranial nerve 6 abducens by doing the 6 cardinal positions of gaze. So what I'm going to do is I want you to look straight at me, and I'm going to, don't move your head, but I want you to follow my finger without moving your head. And she can feel, she can move her eyes in all directions. Okay, so now I'm going to do the corneal light reflex. So I'm going to get my ophthalmoscope, turn on the light, and I'm going to shine the light in the middle, and it should be symmetrical even in both eyes. I should see the light evenly in both eyes, and I do. So now I'm going to look into her eyes again, one more time, and I'm going to look at her optic disc for size, shape, color, the margins, and the physiologic cut. And I see the artery and the vein. And where it's red. Okay. So now I'm going to use it one more time. I'm going to shine the light, and I'm going to check her pupils for make sure they're equal, round, reactive to light in combination. So I'm just going to have you look at me, and I'm going to check your pupils. Okay, good. I'm going to palpate your lacrimal sac, which is, I want you to tell me if you feel any pain or pressure when I'm palpating.
Mm-hmm.
No pain?
Mm-hmm.
Okay. So now I'm moving on to her ears. And I'm going to test her cranial nerve 8, which is her acoustic cranial nerve. So I'm going to get my otoscope, change my ophthalmoscope to my otoscope. And I'm going to first I'm going to palpate her auricle. Good, the cartilage is good, there's no bumps, lesions. And I'm going to look into her ear. And her eardrum, there's gray translucent. Palpating. Gray and translucent. I see the bones. I'm going to perform a test called the whisper test. So I'm going to cover her ear, and I want you to repeat what I say.
Baseball. Baseball.
Apple. Apple. Good. Good. So next I'm going to move on to your mouth. I would put on gloves. Put on a pair of gloves. And what I'm going to inspect are her lips, her buccal mucosa, her teeth, her gums, and her sublingual area. So I'm inspecting her lips for lesions, bumps. The color is good, normal for her race. They're warm, they're moist. Her teeth, can you show me your teeth? Her teeth are white, straight. I don't see any cavities. Her gums, I'm just going to lift up. They're pink, moist. I don't see any lesions. And her sublingual area is pink and moist without exudate. Sorry. Now I would just like you to stick out your tongue. Good. It's pink, it's moist. What I'm going to do is look in her mouth and check her. Stick out your tongue. Open your mouth wide. I'm looking at her uvula. Everything looks good. It's pink and moist. And by saying ah, I'm testing cranial nerve hypoglossal. Cranial nerve 9. Glossopharyngeal. Okay, so now I'm moving on to the neck. I'm going to check her neck for symmetry. It's very symmetrical. I'm going to palpate her cervical spinous process and her paravertebral muscles. I'm going to test her range of motion. Just have you turn your head that way and turn your head this way. And then I want you to press your head up against, holding, good. I'm going to test her cranial nerve, 11, her spinal accessory cranial nerve, and I'm just going to have you shrug your shoulders with me putting pressure. Good, and they're intact. I'm going to inspect and palpate her trachea. It's midline. Still palpating the trachea. Its position is midline and it's symmetrical. I'm palpating her pre and post auricular nodes, her submental and her submandibular nodes. And now I'm palpating her occipital lobes. And now I'm going to inspect, palpate, and auscultate the carotid arteries. So I'm inspecting, palpating. And I'm going to auscultate her carotid arteries using my stethoscope. Put light. I don't have a bell, so I'm going to lightly use my diaphragm of my stethoscope. I'm going to palpate the thyroid gland. Auscultate. Okay. Now I'm moving on to the lungs. So I'm going to check her lung sounds, anterior and then posteriorly. So first I'm going to listen. I should hear good air movement, even on both sides, symmetrical. The lung sound should be bronchial. Bronchovesicular. And vesicular. Okay, now I'm going to palpate her thorax. I don't feel any bulges. So I'm going to, can I have you turn around? Do you mind turning around and just sitting on the, you can walk around to the other side of the bed if you'd like. So I'm going to palpate the back side, and then I'm going to listen to her lung fields on both sides. Take deep breaths, good. You should always go from side to side. Now I'm going to percuss her lung fields. I should hear resonance. Okay, so now I'm going to palpate for tactile fremitus. You can do this on the back and in the front by using the ulnar portion of your hand, putting them on the patient's chest on the back and the front, and having them say a number like 99. And what you should feel are the vibrations even on both sides. Can you say 99?
99, 99, 99, 99, 99.
Good. And then I can do that on the front as well.
99, 99, 99, 99.
Okay, I should feel good vibration evenly on both sides, which is good air movement. Okay, you can come back around. Thank you. So now I'm moving on to her cardiovascular, and I'm going to inspect, I've already inspected her chest for heaves, and there weren't any. I'm going to listen to S1 and S2. I'm going to auscultate the aortic area at the second right intercostal space, the pulmonic area at the second left intercostal space, Erb's point at the third left intercostal space, tricuspid area at the fourth and fifth intercostal space, and the left sternal border. I'm going to auscultate the apical or the mitral area in the fifth intercostal space at the midclavicular line. I'm going to palpate her temporal pulses, her brachial pulses, her radial pulses, and I'm feeling for a pulse in all of these. Her posterior tibial behind her knees, and her dorsalis pedis. Oh, thank you. Good. Okay, so now I'm going to move on to the abdomen. I'm just going to have you lay down. I'm not, because she has on a dress, I'm not going to ask her to lift up her dress, but I would inspect her abdomen for striae, contour, symmetry, no bulges or masses. So I would inspect first, then I'm going to auscultate, and I should hear bowel sounds in all four quadrants at least one every 15 seconds. So then I'm going to percuss her abdomen. I should feel, I should hear tympany. I'm going to, if her aortic area, she's a thin person, so if I would see a pulsation from her aorta. So I'm going to percuss and measure her liver. What I would do is so I'm going to percuss, and I would hear resonant tympany, and then when I hear the dullness is when the lower part of her liver is, not the superior, the lower part. I would draw a line, and then I'm going to go down and measure the lower part, draw a line, and it should be 2 to 3 centimeters. So then I'm going to palpate her liver, which I should be on the right side of her. And I'm going to just ask you to take a deep breath. I'm going to palpate your liver. And it feels good. And then the spleen over here, I should not feel the spleen. In the kidneys, try to palpate the kidneys. Okay, thank you. I think you can sit up now. You okay? Okay. Her cervical neck range of motion, I'm just going to have you put your neck down. Do you have any pain?
No.
I don't feel any. Her spine back here looks good and even. Can I have you stand up one more time for me? I'm going to have you bend down and touch your toes. And while I'm inspecting her spine, does that hurt?
No.
Okay, good. While you're up, I'm just going to have you go ahead and I'm going to do this part. Just have you just stand with your feet slightly apart. I'm doing the Romberg test. I'm going to have you just stand there, and I'm observing her swaying. Now I'll have you close your eyes, and I see if she sways when she closes her eyes, and she does not. Now, if I could just have you walk back, stand back here, and just do a heel to toe step. Okay, good. Let's sit back down. So I'm just going to test your range of motion. I just want you to, again, we're going to shrug your shoulders. I'm going to just forward flex your shoulders, hyperextend your shoulders backwards. I want you to do the abduction, range of motion, and the adduction. Your elbows, I want you to bend your elbows and straighten them. Turn your hands up, turn them down, bend your hands up. Good. Your range of motion is good. Your wrists, if you can hold them out, bend them down, bend them up, flex your fingers out. Any pain while you're doing that? Good. Okay. Can you squeeze my hands? Make sure your grips are equal. Good, they are. Okay, so I am going to have you lay back down one more time. I'm sorry. Well, yeah, go ahead and lay down. Okay, so what I want you to do is I'm going to check the strength of your hips. Raise your hips up against pressure. Okay, and normally I would have her raise her leg up, but since she has on a dress, I would have her raise her leg up and bend her knee on both sides. I would have her push her feet down like you're on a gas pedal, pull them up against my pressure. Good. Okay. And I would have, well, you could stand up again for me. I'm sorry, I'm putting her through the. Okay, so what I want you to do is just you can test it by, you can lift your knee up, and the other one, swing your leg back behind your body, and the other one. Okay, good. And I did your ankles, your lumbar spine. So now I did your head to toe gait, I did your Romberg test. So what I'm going to do, have you sit back down. And now I'm moving on to your cerebellar function. What I'm going to do is a rapid alternating movement. I'm going to put my finger up, and I would like you to touch my finger to your nose, looking at me. Don't look at your finger, look at my eyes. Rapidly. Good. Okay, good. I'm going to perform a test called stereognosis, where I'm going to put, have you close your eyes, and I would like you to hold out your hand. I'm going to put an object in your hand. I would like you to tell me what it is. Good, good. And then another test called graphesthesia. I'm going to have you close your eyes, hold out your hand. I'm going to write a number in your hand, and I would like you to tell me what it is. And do this hand.
4.
Good. Good. So now I'm going to take a wisp of a cotton ball, and I would like you to close your eyes and tell me when you feel.
No. 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 No.
Okay. So now I'm going to take a assess position sense. I'm going to have you tell me if what you're feeling is dull or sharp.
Dull. Dull. Sharp. Dull. Dull. Sharp. Sharp. Sharp.
Okay, good. In vibration sense, I'm going to take my tuning fork and I'm going to hold out your hand. I'm going to activate my tuning fork. Tell me when you feel it.
No.
Okay, good. Going back, I'm going to do a Weber test and the Ren test. So what I'm going to do is I'm going to test her hearing. If this is back, I'm sorry I missed this. So I'm going to activate my tuning fork, and I want you to tell me when you stop feeling the vibration.
No.
Did you feel it evenly in both ears?
Yes.
Okay. Now I'm going to do the Ren test, which is I'm going to activate my tuning fork, and I'm going to put it on her mastoid bone, and I'm going to test air conduction versus bone conduction. Air conduction should be 2 times greater than bone conduction. Tell me when you stop hearing it.
No.
Still hear it? So she heard it 2 times longer than she did on her bone. So now I'm going to check her reflexes using my reflex hammer. I'm going to check her bicep reflex on both arms. Good.
I'm very jerky.
Her brachio, her tricep reflex. So I'm going to hold her arm. Good. Good. Her brachioradialis reflex. Good. Good. Her patellar reflex, which I'm going to go to her knees, go below the patellar bone to the patellar tendon. And then I'm going to check her ankle jerk reflex. Did I forget anything? And this concludes my assessment. Thank you.